AstraZeneca was developed with Oxford University. The vaccine is given in 2 doses, and it has been authorized in more than 70 countries. The U.S. is not one of them. The most recent data, which is now in question, shows the vaccine is 79% effective. Dr. James Baker joins us now to talk more about this particular vaccine. He's with the University of Michigan and specializes in immunology. There are a lot of people already skeptical, Doctor, of the AstraZeneca vaccine, given what I just said. Will this cause more hesitancy?
I'm afraid it will. This is a very disturbing story. This is the largest clinical trial of this vaccine that's ever been conducted. It was conducted and paid for by the U.S. taxpayers, and that's why there was an independent review committee at NIH. And the fact that they announced data at the same time the review committee was looking at a more complete set. Normally, you wait for the review committee to give their recommendation. So this was a self-inflicted wound.
What will this mean for the drug's approval, not only here in the U.S., but also globally, where people are already receiving it?
Well, quite honestly, even if the data is less good, even if it's only 70% or less effective, it's still an effective vaccine. The real issue is that the company has not been totally forthcoming, and that's raised concerns. And I think it'll raise very great concerns when it comes up for review in the United States.
Doctor, some have argued that approval from the U.S. and the FDA will carry a lot of weight, especially worldwide. What will federal regulators be looking into before giving this particular drug the green light?
That's a very good point. This vaccine really isn't needed at this point in the U.S. We have 3 approved vaccines, and they're getting it approved because the regulators are very careful here. And they're going to look at all the efficacy data, they're going to look at side effects, and they'd make sure that the vaccine was both safe and effective for all groups. I think the biggest concern now is that the water's been muddied worldwide. And this is a vaccine, because it's inexpensive and can be stored in a regular refrigerator, could really be important to the world. So I'm very concerned that they've really botched this.
The good news is we do have 3 vaccines available in the U.S. right now. They're being distributed: Pfizer, Moderna, and J&J. 13% of Americans have been fully vaccinated to this point, according to the CDC. Many people are asking if the COVID vaccine moving forward will be like the flu shot, something that we need every year. Is that the case?
Well, I think the first thing we need to do is get everyone vaccinated. And with the president's commitment, I think that can happen certainly by midsummer. I think looking forward, we'll have to see how this virus mutates, whether or not the changes we see in it require a new vaccine every year, or we just wait until the virus mutates to a point where we need a new version. But the good news is these new vaccines can be replicated and produced so quickly that the minute a need is there, it'll be weeks before we have a vaccine rather than months or years.
And we're seeing more and more people each day, and more states receive those vaccines. Dr. Baker, as always, thank you for your time.
Thank you.